Hi, my name is Karis and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Great. Ask me anything you'd like.
Thank you so much. I look forward to learning a lot. So, you're taking care of the patient room 600. Do you have time to give me a report?
Sure. I'll give you a report in our basic standard SBAR situation. So it's situation, background, assessment, and recommendation. And what I have on this patient, his name is Richard Kind. He's in room 600. He is a 67-year-old, well-developed African American male. He has no known allergies. He's awake and alert and oriented times 3. His speech is clear, his posture is upright, and his gait is steady. His chief complaint today is non-healing wound on the right heel. He noticed this progression since 3 weeks ago. He was admitted on Tuesday for high levels of blood glucose over 300 within the past 5 days. So far as background goes, he's a diabetic patient, type 1, approximately for the last 20 years. He checks his A1C level, and 3 months ago it was recorded of a hemoglobin of 5.2. His family history was his father died at 53 with an MI and mother died at 78 with lung cancer. The assessment portion of our SBAR is his temperature was 98, respirations were 18, pulse of 80, rhythm is regular S1 and S2. Systolic blood pressure is 145, diastolic is 72, O2 saturations at 95 on room air. His admission weight, which he states, is 171 pounds. His height is 5'11". His skin is dry and intact except for the stage 2 ulcer around his right heel, which is 5.5 centimeters by 2.5 centimeters at the largest, 3 centimeters deep, extending into the dermis. The wound base is pink with no tunneling or undermining noted. However, moderate serous sanguis exudate was noted. The recommendation for this client was to admit for inpatient unit for glucose control, diabetic teaching, pain management, and wound evaluation and care. We have an order to consult the wound care nurse, as well as the dressing wound with the dry sterile dressing tonight, and we will collaborate with the wound care nurse and team regarding best wound care for the patient and his wife at home.
Thank you so much for giving me a report. Do you mind if I ask you a few questions about the medication administration, then watch you demonstrate giving the medication in the patient's room?
No, not at all. What questions might you have?
Well, I was wondering, why specifically is this client receiving this medication, and what action does the medication have on the body?
This patient is receiving the medication because he's a type 1 diabetic and he needs to have control over his glucose. So insulin is a pancreatic hormone that metabolizes of glucose as well as for homeostasis of blood glucose. The mechanism of action in general is insulin promotes the storage and inhibits the breakdown of glucose, fat, and amino acid.
When should you question administering this medication? Does it have a therapeutic serum level? Also, what vital signs must be monitored, and which physiological parameters should be monitored when the medication is being administered?
The physiological parameters that you would monitor would want to be the blood glucose level, so you would do a finger stick, and then you would want to watch respiration rates, heart rate, blood pressure, same signs and symptoms that you would watch for hypoglycemia, so diaphoretic, clammy, lethargy, things to that nature.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and also safely at home?
In the hospital setting, you would always want to make sure that you're following the 5 rates of medication administration: right patient, right dose, right route, right order, right time. This would include the triple check medication against the MAR and the Pyxis that you're taking it out of. At home, it is imperative that you instruct the patient for proper technique of administration. This includes the proper equipment to use, so like an insulin syringe, alcohol pads, the correct needle, proper storage of the insulin. It's important. It should be in the refrigerator. And also to rotate injection sites.
What are the side effects and potential adverse reactions?
The side effects would be those of hypo or hyperglycemia. Same as I stated before, which were the diaphoretic, cold and clammy, increased blood pressure, increased heart rate. Any more questions that you might have before we go and administer the medication?
How will you know if the medication is effective?
You'll know if the medication is effective because of the fact that the patient's serum glucose level will be adequate for the food that he's about to eat.
Oh, okay. No, I don't have any more questions. Thank you so much for answering them.
Not a problem. It's important to know your patient and the medication you're administering to keep the patient safe. All right, Karis, are you ready to watch me administer the insulin?
Uh-huh.
Great. Hey, Mr. Kai, my name is Heidi. I'm a nurse here today for your shift, and this is Karis. She's a level 1 nursing student. She's going to be watching me administer your medication prior to your meal. If you could just tell me your name and date of birth. And do you have any allergies? And I just scanned your bracelet. Great, thank you so much, Karis. Alright, so great, we have the green light to go ahead. That we've verified the name and date of birth against the patient's arm bracelet as well as telling me. And then we verified it against the MAR. So I just put on my gloves. And this is regular insulin. We make sure that we look at the expiration date, which is good. And we look at the amount that's required against what the doctor has prescribed. And he has prescribed the correct amount, so I'm going to do 12 units. Wipe off the top of the cup of the alcohol with alcohol. And pull back to 12 units. Okay, so to see, I'm just going back to 12. Great. Method. My alcohol in my syringe. Alright, Mr. Kine, just going to expose your abdomen and take this alcohol and wipe off the area right next to your umbilicus, 2 inches from. And so the next time you just want to make sure, if you have a different nurse than myself, you want to make sure that they know that I did it on your right abdomen. So maybe next time they can do your left. Pinching the skin. Great, and directly into the sharps. Mr. Kind, your food is right here. Is there anything else I can get for you before I head on out? No? Great. All right, your call bell's here and your food's here, and I'll see you. I'll come check on you in a few minutes.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions for you, if you don't mind.
Sure, of course.
Were there any pertinent pieces of information you reviewed before administering this medication to the client?
Well, most importantly, you want to check his capillary blood glucose because administering insulin when the levels in the body are too high can cause potential harm to the patient.
Did this information affect your decision to administer the medication?
Yes, because it's the nurse's responsibility for the patient to take great caution when administering any kind of medication.
Did this information affect how you administered the medication?
Not really. We checked his CBG, or the capillary blood glucose, prior to administering the medication, and then checked our doctor's orders for accuracy on the level of units.
Thank you so much for answering all my questions. I really feel like I understand it so much better now.
Not a problem at all. I'm always here to help if you have any questions at all. I'm going to take a few minutes to go now and document the education I gave to the patient as well as the administration into the computer. Would you like to watch me document?
I would love to watch. Thank you.
Great. Come on.